Assalamu alaikum. My name is Dr. Salik Memon, and I'm an interventional cardiologist. Basically, I am receiving many questions about the MRCP UK. So definitely, I will tell you that what is MRCP UK, what are the different steps of MRCP UK, what are their expectations, and apart from this, what are the pros and cons of MRCP UK, how this will help you in your career progression. So first of all, what is MRCP UK is basically is the member of Royal College of Physicians UK. It has basically three colleges in UK: Royal College of Physicians London, Royal College of Physicians and Surgeons Glasgow, Royal College of Physicians Edinburgh. So after MRCP UK, you can get affiliation from any one of these colleges. So what is MRCP Part 1? In MRCP Part 1, basically it's a 1 day exam of 2 papers, 3 hours duration with 100 MCQs in each. In MRCP Part 1, they basically assess your basic clinical knowledge and some common scenarios which you encounter in your daily life, in your clinics and in your hospital. So it's the MCQs 100 questions, 2 papers of 3 hours. In MRCP Part 2, and you should have some advanced knowledge along with the pictorial interpretations. Like in MRCP Part 2, you will have like ECGs, chest x-rays, CT scans, and some basic MRIs. So you should have the basic knowledge of all these, and some clinical scenarios in which you should know what should be the initial plan for this patient. You should know about the long term and the initial management plan, and the most common emergencies that you encounter in your hospitals or in your surroundings. And the third part is PACES. Basically, it's a clinical based exam in which they will assess that 7 skills, like with 5 stations. Like first station, you will have the chest respiratory station, and the abdominal examination, like abdominal station in station 1. And in station 2, you will have the history taking. In station 3, you will have the cardiovascular and the neurological examination. In clinic station 4, you will have the communication skill. In station 5, it will be the brief clinical consultation. So based on these 5 stations, they will assess your 7 skills. What are the 7 skills? Like they will assist you that are how about your physical examinations, like how you examine the patients. And number 2, they will assist you about the identifying physical signs, whether you are capable enough to identify the physical signs, like if the patient has a hepatomegaly, if the patient has a splenomegaly, if there's any rash anywhere of the body, like the different facial appearances. So they will assess your identifying the physical sign. And number third skill they will assess is basically the clinical communication, how you communicate with the patient, whether if whatever you are saying, whether it is understandable for the patient or not. And and the fourth one is the clinical judgment. They will assist you, like after examination, what's your clinical judgment, what are your management plans. And number 6 is the managing the patient concern. Like if the patient is asking you, doctor, that I am having disease, so how you will further proceed, you should tell that this is the diagnosis, now we will do this, and this is the management plan. And what are the different prognosis, and what are the different further risk factors of this disease. So you should know how to deal with the concern of the patient. And last is the patient welfare. So they definitely they will tell you that about the patient welfare, that you should treat the patient with proper dignity, you should respect the patient integrity, dignity, and treat him with full respect. So this is all about the MRCP 1, MRCP 2, and the PACES exam. After passing exam, you will have to give the English exam like IELTS or OET for the General Medical Council registration. After General Medical Council registration, if you have the license to practice, you can work in UK, anywhere in the UK as a registrar in internal medicine. If you have a further experience like in cardiology, in gastroenterology, in chest medicine, so you can work in different department as per your experience, as a clinical fellow, as a specialty registrar, or as a trust grade registrar, depend on your experience, previous experience after MRCP, after GMC, so you can work in the UK anywhere. So this is all about the MRCP UK examination, and definitely it worth it. I do understand it's bit expensive nowadays because of the current scenarios, especially for the developing countries, but definitely it's really worth it, and it will give you the crown of the membership of the Royal College of Physicians UK. So I wish you best of luck for these MRCP examination, and if you have any query, definitely I will be here to help you, and I will try to give you as much time as I can give. And so wish you best of luck. Thank you very much. Stay in touch.